Hi, my name is Catherine Laporte. I am doing a special needs presentation for my child growth and development class. I will be discussing ADHD, the diagnosis, characteristics, causes, and strategies of the disability and living with it and how to help the child. So, the big question is, what is ADHD? It stands for Attention Deficit Hyperactivity Disorder. The name itself is kind of self-explanatory of what it is. It is considered a disability. It may cause someone to lose focus, memory retention issues, excessive amount of energy, and can cause developmental delays. It is different in every person. Roughly 11.4% of children in the US are diagnosed every year. So, fun fact with that one, boys are diagnosed a lot more than girls at a young age, at a school age, young age, whatever. The reason why boys are diagnosed more easily is because doctors see the symptoms a lot more, and they're not coming up with excuses for boys for like their frustrations and their energy levels and things like that, whereas girls, they tend to overlook girls' symptoms a lot, and they unfortunately just say, well, it's because she's a girl. Girls have emotional issues, girls are whiny, girls are wanting attention, but really girls have it too. And so when a girl becomes a woman and they can go to the doctor and advocate for themselves, they get an actual chance to take a screening and they find out that they do have it. So it's not that boys have it more than girls, it's just doctors are more likely to diagnose boys at a young age. So really, it's 50-50. It's not predominantly boys, it's not predominantly girls. So another question is, what does ADHD look like? It does not look like anything. The child looks typical. There's nothing special about the child that you observe or anything like that. What it actually is the child's behavior. So in a classroom setting, that is more likely when you will start to see it, because children are expected to sit still, listen to their teacher, listen to directions, things like that. And so you're looking at approximately 30 students, and there's that one who's kind of fidgeting, kicking their legs, twirling their hair, messing with their book. They may have their head down on their desk because they don't want to focus. They could even be disrupting like their classmate neighbor to the desk next to them. And at recess, they may have trouble making friends and things like that because they have a harder time keeping their hands to themselves. They lack boundaries. And some may even be considered a class clown because of the silliness, but really it's not, they're not doing it on purpose, but they may just kind of accept it, and that's how people tend to like them. So ADHD does have 3 subtypes. Predominantly inattentive is the first one. It deals with issues with concentration, organization, so kids tend to be a little bit more messier, and some structure. They tend to not listen, not because they're being bad, just because they're losing that focus. They may be daydreaming or disassociating. They lose things more easily, and they tend to avoid doing things that require a lot of thought. They're more likely just to say, no, thank you. I don't want to do that puzzle. I don't want to do that, because they know they're going to become frustrated. Predominantly hyperactive and impulsive is the second subtype. So that is when the child is having issues with their energy levels. They're a little energetic, or I shouldn't say a little, they're a lot energetic. They tend to make rash decisions without thinking. Their brain is going slower than their mouth, and so they're not thinking before what they're saying. People can mistake them for being rude. They can also have a hard time taking turns, waiting, and climbing objects without permission, things that they know they're not supposed to be climbing, but they think it looks fun. So the third subtype is combined. It's when inattentive, hyperactive, and impulsiveness is combined into one. So how is ADHD diagnosed? So a child, the youngest they can be is 4 years old. And even then, it's still hard because children at 4 years old, they are energetic. They are still they're still finding themselves They're still learning rules. They're learning boundaries. There's so many things going on at 4 years old that you may not notice the symptoms compared to other children, or it may just get looked over. So that's why most children get diagnosed around school age. So according to the American Academics of Pediatrics, they split the symptoms into 3 categories. It is inattention, hyperactivity, and impulsivity. And they need about 6 symptoms in total for the child to be considered ADHD. The child needs to be doing these symptoms in more than 2 settings. So it can't just be school, can't just be home, can't just be at the library, can't just be at church. It has to be a combination of places. The child needs to be doing it for more than 6 months, because it could be something else the child is going through. You don't know that. And usually the symptoms are before they turn 12 years old. The symptoms also need to be affecting their day-to-day life. So like if the child is having trouble with homework, paying attention in school, it's not just, oh yeah, I daydream a lot, but like, no, I actually had a hard time remembering what my teacher taught yesterday, and I had a hard time following directions and things like that. So it actually has to affect the child to be considered. And so, like I said, they split it into 3 different types. Inattention has difficulty paying attention, forgetfulness, tending to lose things often. Hyperactivity has very energetic and has trouble slowing down. They fidget a lot when sitting. They talk a lot and cannot stop talking. And they play very loudly. Impulsivity has a hard time taking turns. They tend to talk without a filter. They have a harder time with patience or waiting their turn, which I already said that. Interrupts people when they're talking or asking a question. So like if they're in a classroom setting, you're supposed to hold your hand up and the teacher calls on you, but they may just blurt it out. So characteristics of ADHD in infants. This is kind of a harder one because you're not looking for ADHD in an infant. You're looking for if they swallowed too much air and they're gassy, if they're colic, if many other things. Like there's a million and one things you're looking for in an infant. You're not looking for ADHD. So things like this in infants and in toddlers and possibly preschoolers too, that I'm going to say a lot, it's the parent that notices it. The doctor is not going to ask you if the child's too energetic. The parent's going to be noticing the issues kind of earlier on. And the reason why parents notice the issues is most likely because they have ADHD or one of their children has ADHD. So a physical characteristic. So around 12 months of age, infant can be more energetic than others their age. But you're not going to notice that. Cognitive characteristic. By 12 to 18 months, an infant may not respond to their name being called. It's not because they're ignoring you or anything like that. They know their name, but they're so hyper-fixated on something, or they're just doing their own thing that they don't even hear you saying their name. And issues with sleep may appear at this age. The infant may have trouble falling asleep and staying asleep, and then they also might sleep for a short amount of time compared to other infants. They're definitely not sleeping through the night. And once they wake up, they're energetic and they're ready to go, whereas the parent might be sluggish and need coffee, and they think it's a normal thing and the baby will grow out of it, but really, it is a sign of ADHD. For a social emotional characteristic, infants are fussier and have a challenging time self-soothing, but you may not even realize it because you're wondering if the baby has colic and they're swallowing too much air, and it's just a million and one other things. You're not thinking of anything else being wrong with your child besides that. So some characteristics in toddlers. This is the fun age of terrible twos that may not be actually terrible twos. A physical characteristic, they may show that the child has a lack of fear. They may jump in a pool. Child can't swim. They may see like a high object like a couch or a porch, and they just jump off of it. And they have literally no fear. And they also, which I found this interesting, have issues balancing, and they cannot hop on one foot. I didn't realize doctors tested for that, so I thought that was pretty cool. A cognitive characteristic is, once again, lack of sleep. They may also seem a little bit more cranky, and people can consider them more rude, but really it's a toddler. Toddlers have their own little personality. Social emotional characteristic, they may have more temper tantrums compared to another child, but it is a part of learning, and you're probably not thinking anything of it. They have more trouble regulating their emotions compared to other children their age, but at that age, so many children are having temper tantrums that you're not going to notice a difference. But you just may notice, yeah, they're very emotional, or they may not get their way and they're angry a lot. And those are just small things you notice. But then there's characteristics of ADHD in preschoolers. Now this is kind of where you may start noticing things. So physical characteristics, the child may seem rowdier and more wild compared to other children. They have trouble keeping their hands to themselves, which can affect them making friendships. They may be more aggressive, and it's not that they're trying to be mean, they're just playing rough. And some people, especially like the boys aspect, boys will be boys. Not really. But that's just how it gets excused. And so they don't think about it. And also, unfortunately, they may experience some injuries at this age. That lack of fear, jumping off the porch, jumping off the couch, they can bump their head, they can need stitches, they may have fractured or broken a bone by now. It is a little common. Parents might be friends with the urgent care doctors because they come in so much. A lot of things can happen when it comes to that. Cognitive characteristics, the child may lack stranger danger. So one fun thing about children is that they do have stranger danger, and they know to stick by their parents or their teacher and things like that. ADHD children, they tend to warm up rather quickly to strangers, and that can be a safety issue. And so you gotta watch out for the child. They are more quickly to warm up to the stranger and become more friends with the stranger. They also might be, like I said, experiencing lack of friendships. And so when they talk to an adult's a little bit more articulate, and it's just easier for them. And so they make friends a little bit easier, but still gotta watch them. They probably don't like to do puzzles and things like that because it requires concentration. They may be bored. And parents may start to notice that they are hyperfixated on certain things. Like the child in the picture in my slide, dinosaur everything. Dinosaur hoodie, dinosaur toys, and I'm sure the room is dinosaur everything. But that's not necessarily strange. Some children are just really into things, but like, it kind of reminds me of Sheldon from The Big Bang Theory, which they never like said what he had, but he does have a hyperfixation on trains. And so that's one way to see it. Social emotional. Parents may notice that their child is more emotional compared to other children. The temper tantrums are still there. They may also be aggressive during those tantrums, punching, kicking, and they could also cause some self-harm during those tantrums, like hitting your head back and you can get a concussion. You could be like pinching yourself, like sensory issues, things like that. There's so many things that could be happening. Some characteristics of ADHD in school age. This is where we are probably going to start noticing it. The child most likely has injured themselves at least once or twice. They are still fidgeting in their seats at class. They're still lacking those boundaries at school, playing rough. For cognitive, they are experiencing a hard time focusing. You know, it's kind of the same symptoms throughout it all. Their desk at school may be very messy and unorganized compared to other students. They forget directions the teacher is giving them, and they may be hyper-focused on hobby, like I said, the dinosaur thing, trains, things like that. Social emotional, this is very important for kids with ADHD. They start to realize at this age that they're different. They are frustrated with themselves for not being able to focus as easily. And so they may have a lack of self-esteem. they are probably experiencing depression and anxiety. It is super important to keep an open communication with them and and help them. It's okay. Kids go through it sometimes, and you're gonna have a tougher time, and they are. But just have an open communication and help them as needed. Lack of friends, things like that, and they may have trouble transitioning to another subject, especially if it's something they're interested in. So, some causes of ADHD. So, genetics. If a child is diagnosed with ADHD, the parent may be kind of confused at first and be like, wow, but I went through the same things as a child. And then they realize they actually have ADHD as well, and they can get diagnosed. And another thing is that the sibling of the child may also have ADHD. For example, my husband knows he has ADHD. My son, my oldest, he's 13, he also has ADHD. And so they can relate in many ways. And so it's more common for if a parent has it, the child most likely has it as well. So injuries, when the child is born, if there is issues during birth, especially with lack of oxygen, that can be a reason. Injuring their head as a younger child, concussions and things like that, and also being exposed to lead as a toddler or infant. And prenatal wise, if the baby is premature, if the mother is doing drugs such as opioids, alcohol, acetaminophen, lead exposure, things like that, and tobacco use, the child is more likely to have the ADHD. And you got to consider the mother's health. Is she obese? Obesity also increases the chances. Is she stressed more often? Like I said, prematurity in the baby causes it. And if they have any type of respiratory distress at birth, that it all is big causes. For my husband, for example, he checks every single one of those boxes. So it was kind of just going to happen with him. So, strategies to help with ADHD. So, like I said, they have low self-esteem. It is very important to reward the good behaviors. Look for the good behaviors. Don't just focus on the bad behaviors. Give them lots of praise and lots of recognition for the little things, too. In a school setting, make sure, and I guess also at home, too, give shorter directions. If you say, do XYZ because of this, and this, they're going to forget about what XYZ is. They need just short, direct directions, and make sure you repeat it to them so that they remember it. Make sure that they're staying healthy with exercise and nutrition. Make sure they're eating plenty of fiber, fruits, vegetables, and that they are sleeping well, and they're having lots of water. Make a routine for the child. Make sure that they are their routine is kind of not necessarily the same thing every day, but it makes them easier to remember all of it, and it helps their memory, attention, and stuff like that. Have the student sit closer to the teacher. That helps them not have more things to lose their attention span on. And the teacher can also notice, like, hey, if they're starting to fidget a little too much, if they're looking down too much, hey, let's look up here. And also, this is kind of more of a controversial one, medication, if need be. So, with medication, they have a stimulant like Adderall, Ritalin, things like that people do prescribe their children. It is very monitored by the doctor because a lot of people abuse those kind of medications. And so, if someone gets them for their child, they sometimes take the medication themselves. So the doctor has to make sure that they are only prescribing like a 30 or 60 day dose. And then they also need to make sure that it's in the child's system. And sometimes they do have they test the child's urine and things like that, or blood, to make sure it is in their system. Some people choose not to do medication, which is perfectly okay. It just depends. Every child with ADHD is not the same as the other one. So some children can absolutely go through school and they have different strategies and things like that to deal with it. Some children, they may really do need the medication. So besides that, ADHD, it the children can live an independent life when they grow up. It is not like once they learn strategies to help themselves with it, they can absolutely live a normal, healthy life, and they can come up with their own ways of dealing with things. And once they become an adult, the symptoms may become less, um, especially since their brains, as a younger person with ADHD, the bottom part of your brain is smaller compared to the rest and compared to other kids. But once you become an adult, your brain is completely average sized. And so, like, you may still experience the symptoms, but you can get through it. And the symptoms may lessen, and some people don't experience the symptoms at all. It just depends. It's different for every child, every adult. So I hope you learned a couple of new things about ADHD. I had a lot of fun working with this project, and it also helped me learn more about my child and my husband. So thank you, and have a good day.